no it's a say and cross the coma or montin never see a pet pediatrician and I say obi a was shem kwala so trade the and I didn't see it here and crown it's me do more them sa and I say it's me cry more could be what I think say that is close to 70 66 death near record draw ye pay section into nothing your fast out of people said they say a Dinty a bassa, and that's dinty a man is say, and no be rag gun more, my gun more, say, no more simplicity. Now, busy their class will be called just so for trade dry, or who said, Drew, your papa, and I send your papa. You can't stop standard that there's a meeting requirements, no, what's a meeting. It's no penny for a hand say, magic bread, say on Babette Church, you move your far pediatrician, your far food and drug authority penny, some beb wire, night, your sound come always say. It's your Mr. John Lai or Die Tete or your Food and Drugs Authority Ashanti Regional Head, your bar Santa Memo on the head, Ewa Hanum say, and a Dr. Kwame Okoye or your medical officer, resident pediatrician, Department of Health, Ewa Confirmatory Teaching Hospital, Pennyform Makawa. Okay, now your discussions no a better so pay a topic, you know, your six top standard drugs. Inti me kwama Mr. John, you can't be a stop standard drugger. You trim say.
Well, me da see. My main chair, mon chef, and I need to draw your attention to the fact that I'm still picking the tree language and see me the be fra na yako.
Okay.
Na me pese me chair me Chief Executive Officer Mrs. Delis Dako. Say right. Food and Drugs Authority, we are the government agency and the Ministry of Health.
Okay.
Established by the Public Health Act 2012, Act 851. Say, yen sure say, Niamati say, enro, eduani, cosmetics, household chemical substances, medical devices, blood and blood products, tobacco and tobacco products, and then supervision of clinical trials for new drugs, a better system, and see, now in the course of the work, no, Niama be to me see this issue of substandard drugs, no, in the manufacturing process, who say before you start the process, I was say there should be a predetermined standard how you want the product to be, and the specification is standard. And I was say product no meet, you know, say a metia or how now yema say yema and our authority be gives the marketing authorization. The product is supposed to be consistently produced to meet all these standards. ABR storage condition na ebema product ni ahoden eba from and in the course of transportation any distribution and see where your products are that has been given marketing authorization but BBC and see and to me meet specification it can even be products label and coloring matter in the printing of the label and see so you see substandard your purchase and meeting the standard any specification or both.
No, is it in terms of the ingredients and also in terms of preparation?
Just as I said, before the marketing authorization will be given, products no it was a MET standard no. And our processes with the product no be firm and sana we be final product no and also and see it is a combination of facility licensing and the product itself that is registered. And see and yes say products no contents are not any other thing but it is an authorized product. And so I see here the fact that you have good manufacturing practices interest we been taught chima and see about to me here content no kakrebi ana presentation label no e be a tablet back when I was say e wo blisam and so in the filling process no ube say two shem and I ebi wo hona and shem kra enti that's it.
Okay. Per research no na say per ya disua mu no so no you ho say you falsified drugs.
Okay.
So substandard and falsified drugs, how do we differentiate between them?
Great.
But first of all,
substandard no
dear falsified.
Yes, I'll come to that. Substandard drugs no yamanu authorization and the authority no name say product we wo ho.
Okay.
But when it comes to falsified, your patch say obi akotite baby na sa product no enye ni dia na enye the person has no authorization. Now because of profits and scape enti or the bibi keke ashame.
Okay.
And one register sa product no. And chemical e wom na e go say ye adwuma no in terms of efficacy no what tiso enti say 20 about 10 or less.
Okay.
Enti enu de omu sheda ye but substandard no de enye say they consciously do that, but this one it's fraudulently done. And see difference woman.
Okay.
Yeah.
So how can we detect say particular medicine as a drug is substandard and as a falsified?
Right. At the consuming level no e be din say mo betumi a detect na so de bia ye two nipa fo say we are ana you are managing an ailment na a drop pot bi wo ho na de bia wo fa say wo fa hwe say eno a na aba no. If not so, I will say we can't share authority. FDA is present in all the regions, the websites is there, and even the regions have their email addresses. Ube to me because won kwa dia won to me ho. Na it gets to a point no. Nia omu falsify cry be fe chain the original and ti be din. And before it is pronounced to be falsified, this say authority ashram, it needs to go to the lab to ensure that this is it. Occasionally ube to me say oh packaging way enye enu na de bia me ho. And the FDA was robust system for following up on all the products we give marketing authorization to. Report. In the pharmacies scattered around town, they have been trained and designated as patient safety centers.
Okay.
And see who fire a drone na the effects na was say wunyano unsanka I was say immediately will report to who fire a drone so na experience wunya is not the normal no I was say will report to my baby I will talk free no hospitals so were pharmacists. They are the contact persons of those institutions. You are training you are more forms. After the were application Med Safety app.
Okay.
Who download here? Who bet to me a report any untowards experience? Who benya and now who on the product.
I don't think so people are really aware about the work but we will take home no. Remember what say so that people will know say even crown numbers be on my was say or more a friend or more report to such occurrences na or more. But my member always say na young call Dr. Honum say. And my things are working but FDA as an authority and as an institution are more honum no. Then I'm more expecting citizens and as a public no. Or more sa drugs and last because they say minutes they say AGYEI dia me hobi. Ona mo abehu se dro ewo rubber mu nikita nkofo edro ewo ka mu no mo ton edi enyama na mo ye fa ho na edi na public so betimi aye die to om ho fa na say edi adom ho so say because I don't think say those edro no e free farm system I don't think so am I FM.
Well edro as in edro no there are designated places that I was say yeah amunton
Okay.
like the registered pharmacies and then over-the-counter medicine selling shops. They are registered to sell edronu because edronu, it was a storage condition be as per the manufacturer. And see what did in kekea. Number one, you compromise the safety because temperature no ye high dodo. Now you will be say yeah along that line. Well, there's something we call market surveillance. And the market surveillance no they be in chrome. Say ye who more ye chiom. Unfortunately, who come market setting ye mami phone they wouldn't want to move to any hospital and they will buy from these people. We give them the education all right. Now, just recently, Yachiobi, as we talk now, he's been imprisoned for 15 years.
Really?
Along that line, yes.
So,
yes. And the danger is if you don't buy from the right source, ena BBC nipaku no be hu no wohin. Who reporting ma FDA kra ye be hu no wohin. Enu nti na de bia ye say munko pharmacies ana ko hospital na get the right diagnosis and prescription
okay, so we say something this fact say a draw and say ndre bagana nyina even pharmaceutical shops and say medical shops in town, do they all come through your system for you to inspect?
Right. Food and Drugs Authority, per the law we use, the Public Health Act, Wontumi cried Ghana without first registering. And see, even after the registration, we moved to town, to the pharmacies, the various sales outlets, to ensure that a dry work register and they are kept under the right conditions. Now, because you don't have a very efficient system anywhere, even in the developed countries, some will still filter through. Because when it comes to the authorized ports of entry, FDA officers are all over. And he said, we import and I will cry by the right means. And so if it comes through the unorthodox or unapproved routes, no, and to me, and that is why we have the market surveillance team. So that even if it beats the border posts,
So how often do you go to the marketplaces to do this?
It is a daily routine.
Really?
It is a daily routine.
Not
a matter of being sure, but I'm telling you what we do.
Okay.
Across the country.
Okay.
Yes. In addition to that, we have the reporting system as well. It's surprising that you have not heard of the med safety, because we have been playing the jingles on various radio stations. We go to the schools, we go to the churches. Maybe you haven't crossed our path, but that's it. Yeah.
Okay.
It is all over.
Okay, Mr. John Lai, the CBB. You called Dr. Kwame Sodok. Okay. You see a cough once, and obi cough and also obi bowa. It's a symptoms of say paconia respiratory infection. And I say be cause one in home you and I say a quite of fast home no. Obi timia can say and also be bonnet far about the causes of cough in children under 5.
Okay. Michia all the viewers.
Okay.
Say a cough, and yes, it's only limited to just the respiratory system.
Okay.
Sometimes there are other conditions that are outside respiratory system and also can come with cough.
Okay.
But I'll start with respiratory system. Cough, no, depending on whether say cough ni acute and as a chronic, you can acute nipa na bowa for less than 2 weeks. You can chronic 1 year persistent, so for more than 2 weeks or that's over. Okay. It is a acute now, usually in children on the common causes, if really be common cold.
Okay.
Say you can say you cold at you be. And most of the time no, it comes with the secatan so another cause of cough is pneumonia. You can pneumonia now. It means or lungs no when you're infection our lungs nim nti no usually in addition to cough no bon sakra no be say in severe cases no home be kosro or home ana stay in so and your frail condition means to say is sinusitis nti no most of the time no say your fa don't pay what you nim say there are some spaces where they're supposed to be filled with air. Sometimes these spaces can get infected. It can cause a child to cough. And another common thing is what we call aspiration. Into aspiration, no, say now instead of say a be rather correct passage I could run your phone now call a couple share the airway so that can be now once and call so they more for be straight away the common so that is also something that is common in Tabia Sakola Didi na say or satisfied or bored in he chokes on the food and I say or the toys and kitty be diagonal all of a sudden no but satisfied or bower and I say in home ya satisfied air posture you should think that the child has aspirated and only it's an emergency you have to rush the child. And I say you can't chronic cough now. That's the cough that has been going on for more than 2 weeks. Commonly in colano asthma. One of the conditions that ma in colano bowa eche. Usually one of your more serious in the night. Another condition here tuberculosis. The tuberculosis no bon say in addition to one a colano bon say na lose weight and Edwana Johnson free better baby. Another condition sometimes require exposure to certain environmental inhalants. Akolani openye bit if you open cigarettes into the constant exposure to the cigarette smoke no can also cause a child to have a persistent cough. And outside the respiratory system no usually heart conditions in children. Into more warmer, there's a structural problem with the heart, a free baby congenital heart disease. And so usually when they have that, they can also cough, and that may also be a manifestation of that.
Okay, Doc. One problem I pa or Ghana Hanum say no. Meaning say parents answer I will fold home for pa say. So mobile then they rush to the pharmacy and I said drugstore near cough syrup. What is your take on that? Okay. The practice, is it good?
Yes, and it's one of the challenging things that we deal with because it's very distressing for the parents to watch the child coughing all the time. So the temptation is to, give the child something which will suppress the cough. But we need to understand, actually the coughing mechanism itself, it helps to actually clear secretions from the airway. So in itself, it's even a good thing that as a child coughs, he clears secretions from the airway, which otherwise, if those secretions are allowed to stay in, they won't have a good effect. And Sana ABR who advocate say, "Yemfa edroway and sayareway, they go through processes, what we call clinical trials. So based on that, that is what will give us the evidence. You can use this medicine for this particular condition. But clinical trials that they've done with cough syrups and all that have actually shown they don't really give any extra benefits. So almost compare groups of children who were given cough syrups, who were coughing, and then groups who were also coughing but were not given the cough syrups. And they found out that there wasn't any extra benefits for those who were given the cough syrup as opposed to those who were not given.
Doc, what can I say is cough syrup
for children.
For children,
yes.
So what do they need instead?
Yes, so I'll come to that. The recommendation is that usually, if for children less than 6 years old, we don't advocate or recommend that we should give them cough syrups. And even some experts even say that even for those who are between 6 and 12 years, they may not really need the cause. And the reason is because cough syrups, they contain certain specific agents which have side effects that can be detrimental to children.
Okay.
Some of them can cause sedation in children. Some of them can cause respiratory depression if mistakenly the child takes an overdose of it. They can cause which is a danger sign. Some of them can even cause issues with the heart condition, what we call cardiac arrhythmias. It means with and seizures. So most of the time we don't advocate that because of the side effects profile of the specific agents that the cough syrups contain.
Okay, so what should they do instead?
Yes, so if a child is coughing, the first thing is that if the child is coughing, now say in addition to that, no, ne home no air cost or home temtem and on home yen so and I say would the granema ne cry uni and I say oh home out dede home minima. These are danger signs. Say you have to rush the child to the hospital and finding nephew and then finding drugstore. But say obo na said these danger signs are not there. If they are katana chino and I say
flames
and I say utimi edia growth maybe bia. Most of the time, what we advise, they say, give the child warm fluids to take. So warm fluids, warm soup, warm drinks to take. That will help to soothe the lining of the which will bring some relief to the child. And in addition to that, it's the akalane enya kata and I said minimum block. Yeah, saline nose drops are very good. What is more, it helps to decongest the nasal passages to bring some relief to the child. And honey, it's actually been shown that it's able to reduce the frequency and the severity of cough. I'm coming to that. So usually, the thing is that we don't give honey to children who are less than 1 year old. Because of the risk of a condition that we call botulism. So because of that, we don't advocate it. But if the child is more than a year old, it's safe to give honey to the child, and it's actually been shown to reduce the frequency and then the severity of coughing in such children. Some people too may want to give the child some lozenges or something, but that one we need to be careful, especially in the younger ones, because they can easily aspirate it, or they are
what's the difference between lozenges and your friend is saying cough syrup? Are they different?
Cough syrup, that one is a syrup, it's in a liquid form. Lozenges na say toffee. Or you suck on it in your mouth. So that's the main difference. But I'd also want to add certain practices that is not advisable. Sometimes, some of the parents want to do like steam inhalation. Say, be a cold at chacolanti. Now, the insure share na the will put so the towel like I say they'll put the towel in hot water and then bring the steam close to the face of the child. It's not advisable. It doesn't give any benefits, and it has the risk of causing burns. For children, it's not advisable. So adults, if you can regulate it, but children, there's a risk of they getting burns from it. Actually, just recently, we had a child on our ward that a very similar thing. Why is she and I'm okay, maybe
you can't say
and about after that, I didn't know as she in the moon in the show.
So because of your friend is saying complication of being so that I say it's not good.
One, it doesn't give any benefits.
Okay.
It doesn't give any benefits.
No, it
doesn't give. It hasn't been shown to give. To it hasn't been proven. To give benefits, and at the same time, the added risk of say the child will get burns. Yes, is very high. We don't want that. And if you pick something like antibiotics, most of the time, if a collaborate or pharmacy, now they'll give antibiotics and all that. Antibiotics should be prescribed by a doctor.
Okay.
And the point is that the commonest cause of cough in children is common cold. Common cold is caused by viruses. I don't know what the antibiotics they manufacture. It's not serving any purpose, and rather increase the chance of the child building resistance to these antibiotics over time. So that one is also not advised, in addition to the fact that you also don't advocate for cough syrups and then cold syrups in children.
Okay, Doc, last question. I am called Mr. or died. Okay. World Health Organization who any Ghana FDA Ashanti region head Tihanom say a issue statement to caution the public about a particular cancer. I say make introduction with the kai promethazine oral solution, Margrave and cough syrup, any the kind of cough. And then the cause of death among 66 children under 5 in Gambia. And our Cassie very, very, very cautious about it. Because said, my tray say a dear was a runima, it's immediate sounds on a buy as a pediatrician. Okay.
And see, I don't know, it's something that has to do with the manufacturing of those cough syrups and then cold syrups. No, usually, you know, when manufacture sanuna, they use what we call solvents to make these drugs. And see, we know the solvents that they used had the potential to be toxic to the human body. Two main ones, a diethylene glycol and a ethylene glycol. So ideally, glycine is a good solvent, but in order to save costs and those things, they opted for those ethylene glycol and diethylene, and that is what caused kidney failure in these children who took these medicine, and that's what led to all those deaths in the children in the Gambia.
Okay, Dr. Odai, Mr. Odai, sorry. How is our quality control system in Ghana?
Right. When we talk of quality control, it begins with the manufacturer up to the consumer.
Okay.
Now, in the manufacturing setting, it's been proven that the most excellent way is to install good manufacturing practices, which means that from the acquisition of your raw material through the various stages the products go through before the final one, storage, distribution, and all those steps till it gets to the consumer must be observed.
Okay.
So this is also to give the highest level of assurance that your product will be consistently produced, meeting from one batch to the other all the standards and specification.
Okay.
So that's good manufacturing practices. Now it is also important to note that in the manufacturing sector, ubenya a different company na active pharmaceutical ingredients. After that, you import and Tiebeko country for the next stage of production.
Okay.
Even in some cases, you have packaging done in different zone. So if you are not careful and a step is skipped or the appropriate steps are not taken, you have problems with the final products. All these steps are just to make sure that we don't rely solely on the end product to assure quality, but the steps involved in producing as well. So in the case we are talking about, well, I don't know whether it's part of it, but from the question you asked, apart from the marketing authorization Food and Drugs Authority gives, market surveillance, which I have mentioned earlier, is also there to ensure that those who distribute, those who transport, those who store, to the extent that we visit the hospitals as well to ensure that those who prescribe are doing the right things, the dispensers, let's say the pharmacies, are also doing it rightly. It gets to a point one visits the hospital and the administration is done by nurses. So all these stages must be included in assuring the quality of the products.
Okay. So do you see to it say the right people prescribe drugs and the right people dispense it? Is it part of your work?
It is a chain.
Oh, okay.
And every portion of the chain is regulated by a specific body.
Okay.
Yes. So in our case, from manufacturing to distribution, storage and distribution, that is where we are. And then the sale itself. So we visit pharmacies to ensure that products are kept at the right temperatures, and documentation that is necessary is also kept. So that should there be a problem, you can easily remove the affected products from trade. Now, the FDA has a very robust system to the extent that the WHO has given the FDA level 3. There are 4 levels.
Okay.
The 3rd level means that the nation has a system that is stable and efficient in medicine regulation.
Okay.
We are striving still to get to the next level, which is 4. At that level, we're going to rub shoulders with the developed countries.
Okay.
The laboratory we have here for the analysis has recently received the WHO pre-qualification, which is the highest any laboratory can get, and it is the first in the sub-region, which means that the level we have attained, any certificate of analysis that emanates from our laboratory internationally will be recognized. No doubt about that. And it gives us an opportunity to train other regulatory agencies. So really, the Food and Drugs Authority, Ghana, has a system that assures safety of the drugs. As I said earlier, there is no 100% efficient system. We still have a few unwarranted ones filtering into the country. But we are up to the task and are holding up to that.
Okay. The ama you discuss this topic, I think say drugs na e buy any na no. They are imported like ye the back country name. And no hane man e passa. Does that mean say Ghana Hanum say we should concentrate more on drugs yankasa ye?
Right, not at all. Not at all. No country can sufficiently supply all the needs. As I said, you have the raw material coming from a different country, and then the finished products also, those that we cannot manufacture here. You know, vaccines are yet to be manufactured in Ghana. We don't have the capacity yet. So you cannot. There's international trade.
Okay.
So because of the cross-country system we have in the trade of medicines, there is a network of information sharing. And that is why we are able to pick the information from WHO. It is such that any detection that is made from any country, WHO would have to be informed so that the member countries will accordingly be informed for the necessary actions to be taken. And when this happened, our market surveillance system, which is very rigid and effective, detected none of the products here. Of course, they have not been given marketing authorization to be used or distributed in Ghana. So there's none.
Okay.
Right.
Upon a caution that buy a free who no. What have you done?
Yeah, so we have checked every part of the country. There's none in the country. And also, for preventive actions, we issued, or the authority issued, a second press release. This time, not to the general public, but to the manufacturers of food, drugs, and cosmetics. They, as Doc put it, recipients. They are, you know, the ingredients that does the work in healing or curing the disease. Does not go alone. You have accompaniments, and these cars that are imported. So if they come and they are contaminated, the likelihood of passing on the contamination to the finished product is high. So this time, all such products will be analyzed before release for use. And that was the publication we gave to the manufacturers of those products.
Those ones sample out. So.
Yes.
And the chemicals, also the ingredient that was used, no? And also they use all the time.
Yeah.
Have the FDA gone through all the other drugs, not specifically the ones that have been named here? Say, sa ingredients in ebi need cough syrup BM or as ebi need drug BM be cause this kind of for instance disaster.
Yes, that we can assure the public that this has been done and we are still doing it, and that is why all finished products, finished pharmaceutical products that come in are also taken through the same regime as well as their raw materials. So there's none as we talk now here in Ghana.
Not specifically the drug, but the ingredient that is in the drug.
Yes, the analysis goes for both the pharmaceutical raw material and the finished products. You know, those who manufacture here import raw materials. Those who do not manufacture but import, they import finished products, ready to use products. And that is why we have subjected both the raw material and the finished product to the rigorous analytical work before release for use.
Okay, I have one. There's a brofanado, I'm fancy. I won't teach you the doors. You know, people lines on numbers, the best calling our TV, and it is so what's in Bosidia now. They are, but over so they are Facebook who owns me online. Ubenya or now as Missibia, what they are for me, Yamama, Ubet me so afraid. We call YouTube so I hold your star health talk a bomb back one way. Your star you are the not the star come home. You will hold my ye screaming live so on. So as in Missibia, all the tournament, you be ano Ediama. Dog.
Yes.
Okay. So your conversation in we just want parents and our kids to be safe. What cautions can you give to parents out there so that they can avoid this brands? Also, Dr. And I say Mr. John can be said they are doing their best, but ultimately can say basis which is not possible. They be able to be betting yearly care far. So a dear advice and I said, dear now betting your catch our form of shame.
Okay. When it comes to buying medicines for children, as Mr. Lai said, there were pharmacies, licensed chemical shops who have been given the authorization, say they can sell medications to children, or to the general public. So, and we can also see that in our setting here, for trial, na obiton we obiton a grow we obiton. These ones and like so many of some of these even herbal products on the market which haven't really been approved by the FDA. You know, these are parents need to be cautious of. And we need to have
first caller.
Okay.
Hello. Okay, yes, awesome.
And we also.
Hello. Good evening. Patrol lady say na kase free. Okay, Patrol Sembu Sane say.
There were 5 years old boy.
Okay.
Wow, for 1 month. And I don't know, say, ask my things. I said, maybe that doctor said, my talk of the doctor by and cook. I said, maybe that doctor. And I over 1 percent. Ever. That's when you move. And if I said, maybe that doctor said, a bit now you ask man.
Okay, that's so afraid. Don't be you are single son. Hello. 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 Yeah.
Hello.
Me pacho so fra.
Hello.
Yeah. Hi. Me pacho low tip ne ti ho tip no ne meaning komo. Hello. Pacho did this na kase free.
Hello.
Yeah. Pacho did this na kase free. Hello. Okay. Hello. Yeah. Pacho did this na kase free. Hello.
Yes.
Me pacho enti o ho TV na so esa me kase wi ansa no your feedback na emboa enti me so lo TV na kasa. Hello.
Yeah, hello.
Yeah, Pacho did this na kase free.
Pacho friend madam, you can find us.
Okay, Pacho Sembu Sane say.
Your friend, Madam, in the percent two.
Okay, Mr. Odami, Pacho Assembly say.
Okay, my friend behind him. What time market are you on market for more air tone? You decided did they have the authorized certificate to sell these drugs and
Okay. Mr. John, or they be you as if it's normal. Yeah, that's so free. Hello?
Yeah, hello.
Yeah, Pacho did say I free.
Yeah, I'm Pacho. I'm giving Kasa from Madam.
Okay, Pacho Assembly say.
Yeah, I'm going to find out. Since they said the cough syrup isn't good for under 5.
Okay.
I want to know if it's okay to give multivitamins for healthy baby. Because we are certain medications how the normative is to let the baby deal very well.
Okay.
Even when the child is not sick, I'm not scared if it's okay to give them multivitamin and other products.
Okay, double answer you. Thanks for calling. Hello? So please, I hope you're taking notes. Hello?
Hello?
Yeah, Pacho did say that free. Hello?
Good evening.
Good evening. Pacho did say that free. It's me a little team, Nick Akrama. Okay, Pacho question is say. Hello? Pacho did say that free. Hello? Okay. We pass for so far. No low TV no. Ain't you more TV no so they make be our bet you can say we are now corporate TV no. And yes sir, a be interrupt with the air can laugh yen get 2 years won't be a question no. Yes, Remo. Okay. Hello?
Hello.
Yeah, Pacho did say that free.
Good afternoon.
Good afternoon. Pacho did say that free.
Maybe God in Casablanca was it.
Okay. Mr. Gordon Pacho Assembly say.
Good in there, but Oma he can draw baggy, Omo grew my town. Almost a fine bell on your mobile.
Okay. I think then one of the major issues pa was said Neddy. Boss, a chichimuma ye. Okay, so Assembly so.
In the bar, Emma, when you're 11 years. They are born in minimum, the poor one, and no spread.
Okay. Yeah, see, baby was simple son of my that's so free. Hello? Hello? If I last caller. Hello? Hello? Okay. Obi any hodia any Mr. John.
Right. That's it. 2 questions.
Okay. Obi about okay.
All right.
Hello? Hello? Me patch low TV ni my. Me patch low TV no.
Hello.
Yeah, patch on this and I can say free. Hello?
Yeah, look at that.
Okay. What's some Busani say?
Hello.
Hello, patch what's some Busani say? Hello, me tell on call. Okay, yeah, your friend for the BCM say the BB asked so free. After you be more questions on normal. Patch.
Right. So the first one, I'll be say drug peddlers no. Ya authorize your mana ya ma mo certificate say o mo to endro. Medical ka say edro no yen ton to say a browning katie so that somebody carries it and runs with it, moves with it.
Very
And see, we have not authorized them. And then the second question was, it's also about the peddlers. That is a straightforward answer. Now, regulation comes in 2 ways.
Okay.
Enforcement, near education. Now, because a demand and supply market, no, the fact that we are here, interested, Bibia, etis a drone won't turn out we use it. And see, Debia, ye can say, we are here, call hospital, get diagnosed, prescription, now at all. Now, so now, say, say, Obia, Okita, a drone, Abia, I spy, and I register cry. Na ordinary now person who talk the eno the wo nanso say wo hu obi saa so report to because FDA to mean we can't be everywhere, we can't be on all the markets at the same time, and see wo hu say obi ta ba ho around certain times now I report ye be fa no as I said earlier obi a ye chi no along the same line no or them 15 years this year. Now, I'm so my to me say, you charge administratively, and see, you charge nipa be brave. But because omu doors, no, they be every day they come up. What they took police, say the thieves are always there. The police gets them, but it keeps going. It's a vicious cycle. And so yeah, boy, a home say. That be beba now all this will be a thing of the past.
Okay,
seriously.
so yeah, because I say focusing your say orthodox drugs, and I say pharmacy, drugstore, a home commodity. What about the traditional medicines? Do they have the right to do that?
Yes. When it comes to usually herbal medicines, they also have designated places. There are registered shops. In some pharmacies, you even find some of them. Once they are registered, they have the authorization to sell, but at the right places.
Okay.
And what's omusu, move with it or pet it. Yeah, that be that. And to that effect, FDA and GPRTU, I can't boom. We collaborated to ensure that no driver will allow such things. But that's so cost. And see, I difficult kakra. Now so yeah that's so here. And see whether orthodox and imported medicine and herbal medicine. Then once it is not at the right place, please stay away from it. You don't know what is even in there. So don't be so desperate to buy anything that crosses your path as medicine.
Okay.
Right.
Okay, Doc. Yes. You take home final voice na fan wrap it up. Okay, no. The answer questions.
Yeah, the questions.
Yes.
It's first call and stage or 5-year-old or about for 1 month. Our man will cough syrups and so on. Okay. Then in Yashas, I talked about the several causes of chronic cough. And for a child saying it, it's best for her to take the child to the hospital.
Okay.
Because I'll say exactly what is going on and causing the child to cough for that long. Obeying here to be able to say chest X-ray, which so or the planet if you won't be able to know that and see our may advise this on finding hospital. Need to mean the correct investigations, what is causing the cough so that we can treat the child appropriately. And one caller was also asking about multivitamins for children. They contain the correct amount of nutrients that every growing child needs. So usually, multivitamins are not really very necessary, so long as the child is eating well and growing well. But there are certain situations whereby we may need to supplement. In getting to ABS, akolane ya malnourished, for instance, then we know that the child is lacking in some essential vitamins which we will need to supplement. And as the ABS, akolane poya wono premature, because of that, they are not able to, or they lack certain essential baby micronutrients which we will need to supplement for those. And as the akolana yare ache or the hospital ache for a long time then we can supplement with those. But for a healthy growing child, the natural foods we have already contain adequate amounts of nutrients and vitamins that they need, so they wouldn't really need
any supplement.
Yes.
Yeah,
yes, I think there was one more. Now we say, or 11-year-old are clearing their throat frequently and then coughing. For that, usually, you know, some certain allergic conditions can present with, say, the child, you know, or time when someone see baby, and I say, or tenya kata, and I say, any crate punsu, any ebe kekano or better posaposanini. So those ones are certain allergic conditions that it's missing, and sometimes, in some cases, they can even be indicative. Say, maybe the child may develop asthma at a later time. So usually, for such situations, it's best to send to hospital for us to be able to really investigate very well, and then we can put the child on the correct and appropriate treatments that they need.
Okay, I think so. You have your questions.
Yes.
Okay. We'll take home there.
Yes. Into cough, the sen I can't want them no. It can be a disturbing symptom, but we have appropriate ways that we can manage. Cough syrups, we don't advocate them for their use in young children because of the side effects and because of the potential, say they can cause a lot of problems if accidentally the child takes an overdose. And if the child is persistent, you should send the child to the hospital. And a little bit about prevention. And so frequent hand washing, frequent use of the sanitizers, if baby cough etiquette. Say we don't advise say use tissue. Tissue, then discard the tissue. And that's only tissue crana you can cough into your elbow. And that and one very important preventive measure and so immunizations. Because the vaccines in the countries immunization immunization program now it's like I say, yeah, then way in Pania. Some of the organisms say to me cause pneumonia in children, no, they are covered adequately our SIA vaccination program. So it's very, very important. Set time also say I was all the way in a vaccine. The parents should take the child so that because a bomb home by free. So many infectious illnesses.
Okay, Mr. John, why or die
right. Per se, as Food and Drugs Authority, Yama Tiefu, we should let you know that FDA is up to the task. You need other international bodies na Juma, and see any such products that is not registered or substandard, whatever is not registered for use in Ghana, no, Yasubeti, and we'll give you the alert. Now, so say your mau information say men use and now will be a fako baka mundi suna munyen pepe. Yani hospitals, any pharmacies, na Juma by way of pharmacovigilance, FDA, any pharmacovigilance center. Say BBC or hospital, like for instance, what we're talking about now. A hospital na omu report to say there's been increased in acute cough cases, no, and a death as a result of what they're using. And see, we are just alerting the hospitals as well that pick the signals, report to FDA. Don't conclude there. There will be a full investigation into it, and then the appropriate action will be taken. And to the consumers, drone buy from the approved sources. There's a likelihood of getting registered products, but don't buy from hawkers or peddlers. It is not sold that way. A draw is dangerous if you don't take it the right way.
A draw is dangerous.
Yes.
FDA, are you accessible?
I said this in my opening remarks that we are all over the regions, in fact, the entire country. Every region has FDA office. Great. We are present in Kumasi at the RCC.
Okay. RCC,
where the minister office Regional Coordinating Council.
Okay.
Yes, that's where our office is, next to Electoral Commission.
Okay.
Now, so you don't need to even come to the office if you are too far away. Just Google and see FDA Ghana.
Okay.
When you say the information, it will go to the appropriate region. We also have at Ashanti region our regional email address, which is Ashanti region at fda.gov.gh.
Okay.
Ashanti region at fda.gov.gh.
Okay.
There's a dedicated officer 24/7 on that system. So any information you have for us, let it come, and appropriate regulatory action will be taken.
Phone lines, WhatsApp lines.
Yes, we do. We have the phone line. Let me just put it up for a TA4. Okay, so 2 lines.
Okay.
050
718
74 20. 050 718 7420. The second line ends in 22. So instead of 20, it is 22. And you can get us on business hours. Okay. You can also send messages through this phone number and we'll get back to you.
Oh.
Right.
Okay. Thank you so much, Mr. John Lai or Tete. So you'll take home now or wrap it up and I say, oh, before we have to say, only for a share.
Well, I don't know when I'll be on this line again, but Christmas is just around the corner.
Okay.
And we would like to advise that when you go out there to buy, pay attention to what you are buying, pay attention to who is selling to you, and pay attention to the quality of products. You may come across products that are near expiry. It is not wrong. However, if you are buying, examine closely the products and buy the quantity you can use within the validity period.
Okay.
Report all unscrupulous dealings out there in the markets, and we'll have a good Christmas to celebrate. Thank you.
Such a great message coming from Mr. John Lai Odai Tete, Food and Drugs Authority, Ashanti Regional Head. They take home very, very good. And now that Dr. Kwame Okoi, Medical Officer, Resident Pediatrician, Department of Child Health. The bad event to have them say, "Obeso was sir." Yeah, that almost said, "Almost in back high, home your Star Health Talk here, bro." I hope say why enjoy show you pa mo when you because they're very important. So see the bro. And once some the buy and I'm tea and we are more shame because class 66 and I say close to 70 or more because of some person more called Jaya Sadi. The power yare na ko jaya sane no so di uwa but say hard in the pants no say your two suffering penny for na omutimi ba ebe boy ti I hope say this health education no etimi abwa and I say be come me production crew Mr. Christian, Mr. Fred and Mr. Ima Bosheba and me ba Yvonne I me piggy back up pants me no ejuma me da say pa me make up every Charlie's makeover. For a Charlie's Makeover 05444950032 05444950032 make graphics so for AGYEI designs open t-shirts open pen open any form of graphic card complimentary cards we be a open bia and we'll see design will be a for AGYEI designs na oye nationwide delivery obey na order bro come for call 05466833647 05466833647 I think Nyako cleaning company almost somewhere all sort of cleaning so car so feel bathroom bibia or carpets okay we are na clean yama offer o mo beba no ma be clean yama o sorry na o feel pra wontimi prefer o mo on ba be yes say joni nyina ma if it's about cleaning dia friend Nyako cleaning company from 024 7067815 024-706-7815. I feel trip Ghana. Almost say almost do beko baby. I did December. Almost call outside Kumasi. If you join almost trip Ghana. We call Instagram. I'll be your more honor. No share or more various activities. Almost be did December no. Other for joining Nelipan session to join your more than almost into point. Special thanks to my resource persons for no. Since we can't kind of my boy is so much. From the FDA headquarters, PR, Gerald, ya ko kakra betini ne me da ono so ase e na doctor Confanoche doctor Error din Dr. Bakodo NML yes ono so me na se bebrebe se otimi eboa me ma me this production bro me da Ghana Health Service for so ase se omotimi so sponsor ye ma itimi call Thailand mo na se bre koma wo so awoje mre e share your star health talk within e de ama AMPOFO nyame admo next week e be say share bye bye. Thank you. Thank you. Welcome.